So great question. What happens when you hit a plateau? So the first thing I always like to remind people is that ketones, one, aren't a weight loss supplement, and two, they're not going to be able to manage or fix sort of all of or any underlying health conditions that you might be experiencing. So some of the things that contribute to weight gain, for example, are hormone imbalance, hormones being thyroid issues, someone is moving into perimenopause, menopause, into andropause, so you're losing your testosterone, you're losing your estrogen. All of these things will contribute to weight gain. High stress, that causes high cortisol levels, and cortisol causes you to store fat around the middle. Insulin resistance, so spiking insulin. Also a storage hormone, so it's causing you to store around the middle. Inflammation, microbiome dysfunction. Those are all things that will contribute to weight gain. So when someone tells me, I'm doing all the things, I'm low carb, I'm exercising, I'm taking ketones, I'm doing all the things, I can't lose weight, you have to look at the underlying factors. You have to look at the hormones, you have to look at your lifestyle, any of the things that might be going on that you need to address. And again, for example, if you've moved into perimenopause, menopause, or andropause, obviously your ketones can't replenish the hormone loss. So it's very important to take those things into consideration. I've said it once, I've said it a million times, that weight loss is hormonal. You have to look at the underlying hormonal picture and the other underlying factors that will actually contribute to weight gain. So it's important to do that. Also, somebody has been losing weight significantly and then they hit a plateau. The two things I'll ask them to do, if they're not already doing that, is fasting. Intermittent fasting, 16 hours from dinner till the first meal the next day, 24 hours once a week, and then a reboot once a month, and that's a really great metabolic reset. And then I'll also ask them to track their food for a week. I don't generally make my patients track their food. I rarely, if ever, I don't think I ever have made a patient count calories. I'm more concerned about the quality of food over the quantity, but there does come a time where sometimes you have to take a look, sometimes your macros need to be adjusted. So just track your food for a week just to get a better sense of really what is going in and out, and see if there are any adjustments that need to be made there. So there are a few different things that you can do when you do sort of hit that plateau.